Welcome back to Med to the Point. Today's discussion is on tuberculosis, pathogenesis, clinical features, and diagnosis. Treatment will be discussed in another video. Stay tuned for future Med videos. Tuberculosis is one of the world's most common infectious diseases caused by the bacterium Mycobacterium tuberculosis. 1/3 of the world's population has been infected with tuberculosis, with the majority of cases seen in Africa and Asia. Let's discuss about the pathogenesis of tuberculosis first. Tuberculosis is an aerobic, intracellular pathogen due to their relative impermeability to acid-base dyes in the laboratory. These organisms are often termed acid-fast bacilli. TB is an airborne infection spread by coughing via respiratory droplets. Only a small number of bacteria need to be inhaled for infection to develop, but not all those who are infected develop active disease. What is meant by primary tuberculosis? When a person infected with TB for the first time, it is called as primary tuberculosis. When the bacteria reach the alveolar macrophages, they are ingested and subsequent inflammatory reaction results in tissue necrosis and formation of a granuloma. These granulomatous lesions consist of a central area of necrotic material called caseation, surrounded by epithelioid cells and Langerhans giant cells. Subsequently, the caseated areas heal completely and many become calcified. Some of these calcified nodules contain bacteria, which are contained by the immune system and the hypoxic acidic environment created within the granuloma and are capable of lying dormant for many years. This is known as the primary focus or the gone focus of the disease. On a chest X-ray, the gone focus can be evident as a small, calcified nodule. On initial contact with infection, less than 5% of patients develop active disease. This increases to 10% within the first year of exposure. Let's see how and when the reactivation of tuberculosis occurs. In the majority of people who are infected by Mycobacterium, the immune system contains the infection, and the patient develops cell-mediated immune memory of the bacteria. This is called as latent TB. The majority of active TB cases are due to reactivation of latent infection, where the initial contact usually occurred many years or decades earlier. Most patients are young and previously healthy, but may have one or more of risk factors for the development of active disease. In patients with HIV infection, newly acquired TB is also common. The majority of active TB occurs in the lung, but extrapulmonary infection occurs with spread to the lymph nodes, particularly the cervical and intrathoracic chains, where it causes active disease in 20–25%. And also via the bloodstream to more distant sites, such as the brain, bones and skin. Let's move to the clinical features and diagnosis of TB. The cardinal symptoms of TB are cough, hemoptysis, and the systemic symptoms of fever, night sweats and weight loss. However, in extrapulmonary sites, respiratory symptoms are often absent and the systemic symptoms are often ignored by patients and medical practitioners most of the time. When there is laryngeal involvement, a hoarse voice and a severe cough may be there. If disease involves the pleura, then pleuritic pain is a frequent presenting complaint. In a chest X-ray, it may show consolidation with or without cavitation, pleural effusion, or thickening or whitening of the mediastinum, caused by hilar or peritracheal adenopathy. Laboratory diagnosis of TB should start with appropriate clinical screening procedures to identify individuals with clinical suspicion of TB. In all cases of suspected TB, it is essential, depending on the site of disease, to obtain sputum, biopsy samples or fluid for microscopy, smear and culture to obtain information on sensitivities. Tissue samples should also be sent for histopathological examination, either dry or in saline. With that, today's discussion comes to end. Treatment and side effects of the TB drugs will be discussed in another video. Thank you for watching. See you next time.